Hello, my name is Austin Sim, and I'm currently a PGY3 radiation oncology resident at Moffitt Cancer Center. I'm happy to be presenting the design of our pilot study on the effectiveness of a 360 video for pre-consult education in patients with gastrointestinal malignancies on behalf of our multidisciplinary team from radiation oncology, health outcomes and behavior, and gastrointestinal oncology. We know that patients with cancer suffer from a high distress burden relating to their initial diagnosis, next steps and options for treatment, and also related to unfamiliarity with the new setting of a large cancer center. Running in parallel, different modalities of augmented and virtual reality, including 360 video, are gaining mainstream recognition in providing immersive experiences. As such, we endeavor to create an introductory video to illustrate our clinic workflow to set patient expectations and reduce distress. The purpose of this study will be to evaluate the effects of implementing this video on patient distress and overall experience prior to initial consultation for patients with gastrointestinal malignancies. This video is both narrative-driven and co-developed with patients, as it follows a single patient's journey from diagnosis through the initial visit. The actor portraying the main character in the video is an actual patient who was treated at our institution. Our original intent was to have a VR headset at this conference for attendees to view the video, but unfortunately, this is no longer possible. This will be a single-arm pilot prospective trial. Inclusion criteria include all new patients to the GI clinic who are at least 18 years of age and able to read, speak, and understand English. Given the technology in use, we will also require a smartphone, tablet, or VR headset with internet access. Lastly, this must be the patient's first visit to our center. Our data will consist of responses to 3 electronic surveys, as well as data from the medical record. These surveys will be administered at 3 different time points and consist of validated questions to measure distress, understanding, and satisfaction. The schema of our trial is depicted here. With our first contact, we will gauge interest in participating in this trial, and informed consent will be obtained on a subsequent call prior to releasing the video link. Surveys will be completed prior to and after viewing the video, and a third survey will be completed after the initial visit. We anticipate enrolling 70 patients over the course of about 4 months, given that we see about 10 new patients per week in this clinic. Data will be analyzed using the Mann-Whitney U-test for differences in survey responses between patients, and using the Wilcoxon signed rank test for differences in survey responses at different time points for the same patient. Navigating a new environment and workflow may intensify patient distress related to a new cancer diagnosis and consideration of treatment options. The immersive nature of a 360 video may more effectively convey information and reassurance to patients prior to this initial visit. Emotional distress is often a neglected patient-reported outcome that we hope to evaluate more clearly in our study. Thank you for your time and the opportunity to present our preliminary work. We look forward to presenting our results, and please feel free to contact us with any questions.